Good morning, everyone. If you're new to this call, let me introduce myself. I am Erin Barger, the project manager for Envision Athens. It's my honor to share the space with you this morning. Envision Athens is the 20-year community and economic development strategy for Athens-Clarke County. Welcome to Healthy Athens. This is the work group for the health domain, which is one of 14 domains within the Envision Athens action agenda. So I see a couple of new faces and it's a new year. So how about we do very quick introductions if you can kind of be ready to unmute yourself. And I'll just ask you to share your name and your role and welcome again. So let's start with you, John.
Hey everybody, John Morris. I'm the project coordinator at Envision Athens.
Welcome. Savannah.
Good morning, I'm Savannah Farr, and I'm a new fellow with Envision Athens.
Welcome. Shannon.
Hi, I'm Shannon Corda. I'm with Alliance Recovery Center.
Good to see you. And is this your first meeting?
Yes, I'm sitting in for Julia. She couldn't make it today.
Nice to meet you. We're glad you're with us.
Thank
Judge
you.
Auslander.
Chuck Auslander with the state court. I also am part of a team that runs a treatment court that focuses on repeat DUI offenders and addressing their substance use disorders and providing them support.
Great. Thank you for joining us. Esther. You're on mute, Esther.
Esther Maddox Counseling Services. My area is, I'm an alcohol, drug, and gambling counselor, and I do trainings in that area as well as individual work with individuals.
Great. Dr. Watley.
Hello, everyone. I'm Dr. Watley. I am the Executive Director of Student Support Services at Clarke County School District.
And you are how many weeks in your position, Dr. Watley?
According to my LinkedIn, I'm about 5-point-something months in, so I'm making it through, but I'm here.
You know it's real when you move from the weeks to the months. So.
Yeah, so I'm here.
Welcome, welcome. We look forward to working with you.
Same here.
Melinda.
Good morning, I'm Melinda Allen, the Executive Director of Bethel Haven, and we are able to provide counseling for those that do not have insurance and also a sliding scale for those that do.
Good morning. Ed.
Hey, I'm Ed Moore. I'm the coordinator for community health and well-being for St. Mary's Healthcare Systems here in Athens, Georgia. Good to see y'all. Thanks.
Good to see you, Ed. Harrison.
Good morning, I'm Harrison. I'm the Executive Director of the Backpack Project. We pack and distribute backpacks with the supplies and give them out to those experiencing homelessness, as well as some other stuff.
Good to see you, Harrison. Thanks for joining. Beverly.
Hi, I'm Beverly Grant. I'm the counselor at the Athens Department of Community Supervision Office, and I'm also on the board of Athens Recovery Fest.
Great. Tiffany.
I am Tiffany George, Executive Director for Family Counseling Services. We provide individual couples and family therapy. We are also the treatment provider for the DUI drug court, and also see people for general counseling for substance abuse as well as court-ordered evaluations.
Great. Glad you could join us this morning. Thank you. Megan.
Good morning. I represent both the Athens Wellbeing Project and the Council on Alcohol and Drugs.
Allie.
Hey, good morning. I'm Allie McCorkle with Athens Clinic, and I also work for Access Point of Georgia and Georgia Overdose Prevention.
Good morning. Welcome. Brandy.
Good morning, everybody. My name is Brandy Anderson, and I'm the founder of Acceptance Recovery Center.
Welcome. Michael.
Michael Bean, Street Outreach Coordinator for Advantage Behavioral Health in Athens-Clarke County.
Larnie.
Good morning, everyone. My name is Larnie McCarver. I am the Interim Intake Coordinator and Outcomes Manager at Acceptance Recovery Center. I am also the new president at the Georgia Association of Recovery Residences.
Also
otherwise known as GAR.
Yeah, congratulations, Larnie. Proud of you. And Alexis, would you like to introduce yourself?
Sure. Ann Alexis with the Eco Incubator. I'm a holistic healthcare practitioner and orthomolecular nutritionist.
Great, welcome. All right, everybody. Rather than just jumping right into our conversation about naloxone, what I would like to do is pull up our plan of work. Some of you are brand new to this particular meeting group. And so can you confirm that you can both see my screen and that the success measures are large enough to read for you? Is that working for you? Okay. Michael Bean says yes, so I'm going with it. So as you can see, the reason that we convene together is specifically to focus on supporting optimum health by providing substance use disorder prevention and awareness, and increasing coordination of and access to supportive services for people affected by substance use disorders, as well as those searching for and living in recovery. This group has been convening for several months now. The first action for Envision Athens within the health domain, and you can see this kind of at the bottom of this first column, is to first develop an effective behavioral health crisis response team. And so the group came together actually in the summer, so August of 2018. And after, convening and getting everyone to the table, we decided that we really wanted to move from gathering and sharing updates to pursuing a specific objective. And for so many reasons, the objective that was selected for our area of focus was supporting people living in recovery. And this group came to a consensus around the 16 success measures that you can see listed here. Some of you are very familiar with these, but I'm going to give you just a minute in case you're new, just to take a little bit of time and look through these. And maybe some of you could use a little review session after the holidays as well. What I would suggest that we do with our limited time this morning is to focus the discussion maybe in the second half on naloxone and increasing access to naloxone or Narcan, and then inviting you all to give any updates related to your agencies. Before we get to that, I thought it wouldn't hurt just to go through these success measures and ask anyone to weigh in on what momentum there is currently around these items. So can anyone, well, before we do that, let me stop sharing and see all of your faces. Do you have any questions about that plan of work and how we arrived at those success measures? Okay. So back to the plan of work, looking at the first and second, those both relate to the individuals trained with the Respect Institute and, speaking within that, as well as recovery messaging training. I'm curious if you all have any updates about that, particularly related to COVID impact.
What I know is they've moved those. I don't know if they're still doing the Respect Institute training, but the CARES Academy is still moving forward, and they've developed an online course that has been rather active and engaging. We have 2 team members that are going to the upcoming training, as well as one of our alumni. But as far as like getting a list of Respect Institute graduates, I think that would be something that's fairly easy to do. Larnie has a standing relationship with them. If she wouldn't mind reaching out to see if that's something they would share with us.
Sure, yeah, I can reach out to them.
That would be great. And related to that, not to derail us, but I know that later in the year, Brandy, you and I spoke about, and within this group, we talked about the benefit of planning some kind of Recovery 101 session that would kind of share some basics and helpful areas of understanding with people who don't have experience. Is that something that actually has moved forward? And if not, is that something that this group is interested in making happen in 2021?
We haven't, acceptance recovery hasn't moved forward with that. We would love to collaborate and to be a part of that. Just speaking on success measure number 2, we've had 3 recovery messaging trainings the end of last year, and we plan on that we're public. We have them every month for our residents, but we plan on having 4 public events, at least virtually, coming up this year. But as far as the 101, we would love to collaborate, and I think that it is something that would be really beneficial for our community overall.
And just to clarify, maybe for folks who are new to the conversation, and so I can be sure that my understanding is correct, recovery messaging training is for the purpose of training people living in recovery to talk about their experience, right? And then the Recovery 101 is something that we would collaborate to create to then deliver to people in the community who would benefit from increased understanding.
Can I speak on that, Brandy?
Go for it.
So recovery messaging it doesn't have to only be for people that are in long-term recovery. It can also be for advocates and allies. So recovery messaging also teaches those that are advocates and allies how to share how recovery has impacted them, and basically how to share how recovery has impacted them and to share their recovery story in regards to what their lived experience is with persons in recovery.
Thank you so much. I wasn't aware of that. And I think that's a really important point, because that lets me know that this is actually for me. That's something that I would invest time in. What is the duration of recovery messaging training? Like how many hours and over what span of time?
It's an hour. It's
Oh,
about an
wow.
hour long. Yeah, and it's about an hour long. It takes about 30 to 45 minutes to give the training itself. Leaves about 10 to 15 to develop the actual elevator speech, and then some time to practice it and present it to the group that's being trained.
Well, based on that, I hope it's not out of place then for me to recommend that anyone in this group who hasn't participated in that training to do so. And I will commit to participating in that training sometime in the near future. Who can share information on upcoming trainings? Would that be Larnie or Brandy perhaps?
Yeah, Larnie does it for our center with our agency. And then there's a list of trainers that the Georgia Council has where they do. I haven't seen any as of lately that they're doing publicly, but we would be happy to set one up with Envision Athens, with Healthy Athens, if that's something you're interested in. Just shoot us a couple dates and we'll get something set up.
Great. I'm just making a note of that. Okay, great. And then next, let's hold off on the third one. That is something that is very much a priority. I've had a lot of conversations about advantage behavioral health systems regarding conversations with property managers and working with them to increase their willingness to rent to more people. And so that is something, as you can imagine, is fairly complicated. Are there any updates from anyone in this group on that before we move on to the needs assessment? That is one of our long-term success measures that I will definitely be updating you on, hopefully in the next 6 months. And if any of you have questions about that, please feel free to follow up with me offline. Meg, would you mind to give an update on the fourth item, the needs assessment?
Sure. So for those of you who are new, we conducted a provider side needs assessment for the community, Athens, Clark County, as well as the 16 surrounding counties that we serve. We're just getting into the data right now. We had a lot of cleaning up to do. I think I mentioned this last time, it got hacked. So we had hundreds of responses that we had to sort through that were not legitimate. So we ended up though hearing from over 60 providers. We got about 90 responses, and we are presenting preliminary findings next week to a smaller group. So at the next meeting, I'd love to share some more information from that, but people spent a long time on the survey, and I'm excited to see kind of where everyone's at and what we can do moving forward.
Great. So we'll make that a key agenda item for our February meeting. Thank
Great.
you, Meg. Appreciate your work on that. Guys, we're going to skip 5 and come back to that for a more full body discussion. And just to kind of pick up the pace here, if you all wouldn't mind to look through success measures 6 through 16, and if you have any updates or questions about those, now is a great time to do that before we dive into our naloxone conversation. Beverly, any updates on Recovery Fest? Is that something that is a consideration for 2021, considering COVID?
Well, we did a virtual version last year, so I mean, we're always hoping to get back to the in-person, but we'll just have to see how things go with COVID. But we will do some version of it, even if it's virtual.
Mm-hmm, mm-hmm. And what month of the year would that be?
September is recovery month, so it'll be September, or this year it was October, but the extenuating circumstances.
Understood. Okay. And then as many of you know, SBIRT was offered in 2020, and that went extremely well. Both that and the trauma-informed care training that's mentioned in number 12. Those trainings were offered through a partnership between Envision Athens, Athens Wellbeing Project, and the Athens Area Community Foundation, funded by Resilient Georgia. So if you're new to this conversation and did not have access to those trainings, they are available on our YouTube channel. So that is something that we are happy to share with you. And they were really, they provided really excellent content. And that is, that partnership is centered on increasing the trauma-informed care of all services in Athens, Clark County. In a sentence, trauma-informed care equips people to deal with the question and interact with people asking not what's wrong with you, but what happened to you. MAT, otherwise known as medicated assisted treatment, also is something that gained some momentum, and there were some trainings around that in 2020. I would love to hear from you all regarding if this is an area where you would like this group to focus even further in 2020, or do you think we're at a good spot and should focus elsewhere this year?
I can only speak for myself, but I feel like we're okay. We've kind of blown up since COVID started. And I know that both of us, myself and Alliance, have had so many new patients. So I can't think of anything that's not, not being addressed, not being done. What would you say, Shannon?
I mean, I agree with you. It's been a crazy busy year. We've had so many intakes, so I don't know.
Mm-hmm. Okay.
I think I'm just trying to get through day to day. So I can't think of having like another training or anything, maybe let's get on the other side of this thing and kind of see what happens first. But
Absolutely.
Yeah, I think we're good.
Yeah, and since this is our first meeting of the year, I think it's a good time to kind of take an inventory of what we've done and where we want to focus next. I think the guiding cornerstone of that decision making will be the results of the needs assessment that we're digging into next month. So anything else of note on this list before we kind of transition to a deep dive into naloxone? Let me ask this, is there anyone missing from this group regarding number 13? That's an item that has been on our plan of work, yet I'm not certain we have all of the perspectives at the table to address youth aging out of juvenile services. So I would welcome your feedback and input on that.
I'm on the safety stat. I'm happy to bring that up at our next meeting and ask if they can recommend. We've got a couple of judges and people who are involved in juvenile justice and recovery and things like that.
Right, right. So I know, was it Judge Shearer?
Judge Trimble is sort of leading the.
Right, right. And this might be worth noting, especially for those of you who are new to the call. It may be that one of these items is not one that will be addressed, every month, but it is worth its own kind of separate work group. So that is also kind of a pivot that we're willing to make when the work calls for it and when we can make more progress that way. And then Dr. Watley, we're really pleased to have you for many reasons. Specifically, number 14 is focused on partnering with the district to kind of learn about how the district is engaging in prevention and awareness related to substance use disorders. So I don't want to put you on the spot this morning, but comfortable maybe sharing a little bit more about that if you want to now, or maybe in the next meeting.
Definitely. One thing that we kind of, not only students with substance abuse, but we just rolled out a process, and I think it'll be good for you guys on this line to know about. Within our J policies, it mentions the case consultation management process, and that's for students who are coming back from most restrictive placements, such as DJJ or even mental health places. And what we found is when those students were coming back, it was almost like a drop-off, not necessarily a structured kind of sit down with that multidisciplinary team of psychologists and social workers and even whoever's needed, right, to create a plan for those students. And so I would love to share that with you with my director of social work, because we've received quite a few students back from mental health through that process. And it helps to streamline what resources we're going to put in place for them, either virtually, if when we were in person, and it kind of forces that team to come together prior to the student enrolling. So no one is really scrapping trying to get what this kid needs. But in terms of like substance abuse and like preventative things, we do have some things in place. But I'd like to speak to that next time, Erin, like if, to talk more specifically about those things, I would love to. And I definitely want you guys to kind of know what's happening on our side, because we will definitely lean on you to help this process work for our kids and our families.
Absolutely. Yeah, I'm already excited to hear more. And in past conversations, one thing that your predecessor, Dr. Myers, had suggested, and I'm not sure how much traction was able to be made, but just kind of filling you in on this, and very much to your point of equipping the people who are interacting with young students with the information to be able to do that in a trauma-informed care way, was to request that if a student, a Clark County, to be specific to the district, if a Clark County School District student has some form of interaction with police, not just individually or independently, but if police was, in the home or responded, for instance, to a DV incident, if the school could be made aware of that before that student returns, that heads up would promote a truly improved trauma-informed care perspective. So just to kind of share that might be kind of a note to pull from our past and bring into conversations that you might have with Chief Sizemore and Chief Sproul.
Absolutely. It's interesting that this conversation is coming up because right now we're looking at our MOU with the police. And right now there's a huge sweep of, across the nation with defunding police. And then that kind of impacts our work in schools with defunding SRO cops. And so a huge piece of the work that the SRO cops are going to be doing is working with student support services, going through the trainings with trauma-informed care with us in our division, as well as restorative practices and those types of things. They are also going to be really an instrumental component for students returning from DJJ through that case consultation process. So it's not like they're going to be called in when the child gets in trouble. No, they're going to sit on that team. And so it kind of helps with creating that relationship. And again, we can say we're trauma informed, but what do our practices look like? It goes to, how do we receive kids? How do we take care of kids? And when they get in trouble, how do we respond to them? Another piece that we're working on too is rolling out a very systemic training across the Division of Student Services involving trauma. Trauma-informed care practices, but first understanding where you are with your own personal trauma. This Friday, the entire Division of Student Services is going through a training entitled, Are You Okay? Because before we can work with other folks about their stuff, we have to identify our own. And so Friday, they will be going through a training with all of the counselors, social workers, psychologists, and nurses, as well as some people in special ed. And that's a part of like the systemic training of trauma-informed care. So starting with you first, right? And then working towards them, because I think sometimes we can come from they need, but we ourselves have our own traumas that we haven't really uncovered and unpacked. And when you encounter other children who've been through that or other families, then sometimes it triggers your stuff and you're unable to really implement a program fully. So really helping the whole system become more trauma-informed, not just trauma-informed towards the child, but even in terms of how we operate as a district. My ultimate goal too, when we move into our next building, is to create a district wellness office, just a place where people can go and unpack their thoughts and, hopefully have wellness rooms in schools. So, long-term, that's something that I'm really looking towards doing. Folks on the screen will be helpful in partnering with me as we get stuff done in CCSD. So thank you, Erin, for dropping that nugget.
I love your vision already, Dr. Watley. I can't wait to hear more. And just so you know, and this might be a reminder for some folks who weren't able to join last year, but I mentioned the trauma-informed care training. This was hosted in May, and we had about 450 people attend virtually. It was led by Dr. Brian Bride of Georgia State, who literally wrote the book on trauma-informed care. And there's a specific component that might be of interest to you, Dr. Watley, and some others if you weren't able to join. He focuses specifically on secondary trauma and the impact that it has on people delivering and providing services when they are experiencing trauma in a secondary fashion and the cumulative toll that can take. That is on the YouTube channel. And I see in the chat box, we're locating the expert training as well and can send that out in the notes so that you all can access those. Awesome. And Dr. Watley, as you were mentioning this kind of team and somewhat interdisciplinary perspective, that made me think of the great work that is happening in our treatment courts. Judge Auslander, and I'm so glad that Tiffany, you're able to join us today. Would love to hear just any updates you have, Judge, about the treatment courts and any support that you could use from this group this year.
Well, we're very fortunate that all the agencies, especially the ones that are here, whether it's providing the MAT, providing the counseling services, providing the residential beds, have been unbelievable in this time. I mean, we've been able to place people where they need it. They're continuing to get their medication, continuing to get their counseling. I don't have any specifics except for if there was a way to overcome COVID that wouldn't delay us in being able to safely place people into Advantage's inpatient or get people into the different recovery residences. That's, I don't know that we're going to solve that here. I think we've done everything physically possible this group has to make business as usual so people don't suffer. So I'm just incredibly impressed.
Mm-hmm. Thank you, Judge. And most of you were not in our 8:30 meeting this morning, but you're aware that the safety group meets just before this one at the same time of the month. And so just wanted to briefly note all the transitions that are happening in the community, because I think those have the opportunity to positively impact our work. And so the safety group is focused on reforming, improving community supervision, also known as probation, to make it more person-centered and basically achieve an optimum blend of accountability and opportunity. And on that call this morning, we welcomed our new sheriff, John Q. Williams, and our new district attorney, Deborah Gonzalez. And I am participating in her transition team. And many of you have seen the memo she sent out, and in that memo, including her plans for her work as the new DA, she mentioned specifically the role of treatment courts and is very supportive of that. So I look forward to more and more acknowledgement of the role that those play, and hopefully more support for those as well. Support has already been good, just to be clear, but we could always use more. Tiffany, is there anything you'd like to add? I'm so glad you're with us today, and family counseling has played an integral role in those courts and many other things as well. So anything you would like to share?
Not in particular. I will let you know with the school systems that Family Counseling Service used to have counselors on site at the school systems, but it was part of a grant that we had in the past. And so we were doing drug and alcohol prevention counseling. We were meeting with folks, providing assistance to the counselors at the school, but more in-depth with children who were facing kind of more serious problems at home. So we are obviously involved in the DUI drug court, but we're also in veterans court and see some of the TAC court clients and have a big role. And we just see the progress that those clients are making, having the wraparound services available to them, and really looking at some of the underlying issues of why they have criminogenic behavior. So I just want to thank everybody for allowing me to come today and have an opportunity to see some of the folks that I know that we refer to and that we are working with closely to better serve our clients.
Fantastic. All right, so let's dive into a conversation about naloxone. I remember, and you probably do too, when we started talking about naloxone, and I asked you all to tell me, where should we have naloxone? And you said everywhere. I was like, okay, guys. You know, I love you. We have to start somewhere. Let's make a plan that we can digest and make actionable. And so in the last 6 months of 2020, we had some conversations ranging from unified government to small business owners and others to discern what is the optimum placement for naloxone. Before I go further, I'm just aware that not everyone on the call might be completely familiar with naloxone. Can someone give like a 15-second description of it? How about you, Brandy?
Unmuted there. Okay. Yeah. So naloxone's an opioid overdose reversal. There's several. Allie could give a way better presentation than I could because she's actually a trainer. But it's essentially it's available now at all pharmacies. And if somebody is overdosing on an opiate, they could potentially save their life. You could have to use more than one. Most recent intake at Acceptance Recovery was his last overdose. It took eight different administrations in order to bring him back from a overdose. So it is life-saving. It can be rather expensive. However, there are free resources. There's free trainings. We've hosted some. Allie's done several of them. It used to be, and it still does have a large stigma associated with it, as almost of giving somebody that is using an excuse or a pass to use. However, with the education and training that's being facilitated all over Georgia and other states, it's proving to be a very effective use and harm reduction, and ultimately to save lives, because if a person's not breathing, then they will not be able to find recovery.
Thanks, Brandy. I'm actually going to Allie next, so I just wanted to mix it up a little bit. Allie, I would love to hear from your perspective. Thank you, Brandy. How more widely available, in other words, what increase we've had in making naloxone training and naloxone itself more available, and then would love to hear, John, if you could kind of update us on, where we are in terms of incorporating naloxone further into the community based on conversations you and I have had. So Allie, can you kick us off there?
Sure. So COVID kind of messed everything up. We had a lot of big trainings planned, and obviously we couldn't do that anymore. But the good thing is now Georgia Overdose Prevention now has a recorded Narcan training. So we can share this online with people, and they can come to my clinic or come to other different places and pick up a kit afterwards. So that alleviates the need for having a big group. So if anybody wants that, I can share my email in a minute in the chat box. But we have 2 trainings coming up. We have one with Dawn next week, and one with Beverly at probation the end of the month. So yeah, we're still, even though we can't get together in a big group, we're still trying to get it into as many hands as we can.
Aaron,
You're muted.
Thanks, guys. Is that training something you could send the link for? And we could
yeah.
Yeah. That is something, if we all agree to embrace the importance of this, which I know we do, but to act on that by sharing this and giving more people access to the conversation and the training itself, I think that will, if nothing else, it will serve to start reducing the stigma around it, and it will help to normalize it. So yeah,
let me reach out and get a definite okay, but can't think of a reason why they wouldn't want me to do that.
Yeah, especially because it sounds like you can't get the naloxone until you've done the training. So is that accurate?
You don't have to necessarily do a training as extensive as this. Like some of us will meet with folks and show them how to use a kit in about 5 minutes. But if your organization wants a little bit more education and training, then that recorded one is perfect because it gets a lot more detailed.
Yeah. I'm in favor of more detail versus less around this. So that I would be happy to share that and have Envision share it across our networks. So
okay.
Yeah, that's great.
Find out for you.
Yeah, thank you, Allie. You are our go-to for all things naloxone, Narcan. Thank you for that.
Well, Brandy gave a really good explanation, so you don't need me.
No, we need both. We're a both and people. All right, John, would love your update, and thank you for doing some work to get naloxone in the hands of more people.
Yeah, thanks, Aaron. And thanks, Allie. Looking forward to training next week that will have Athens PBJs and the Backpack Project represented. I know Harrison's on this call and might be able to speak towards that. I think working with Michael and Riley and Allie to increase access to Narcan and naloxone amongst populations of people experiencing homelessness in Athens is a big agenda that a lot of us have and have worked in our other subgroups with. I know I also work as director of Athens PBJs and have a lot of friends that have expressed a need for Narcan and or naloxone and training on how to use it. Some of them have told me that they have it and don't know how to use it. Others have told me that they have it and have administered it to other people living in encampments with them. So it is surely urgent to ensure that they have access to these potentially life-saving drugs to overturn any overdoses that may occur. So I know there's been progress made in that area. And then I know, Ali, I think you mentioned that there's another training that you're doing next week. So that's the general update from me.
Harrison, is there anything you would like to add? And maybe if you wouldn't mind to just briefly introduce what the Backpack Project does. I don't know that everyone's familiar with your group.
For sure, yeah. So the Backpack Project is a nonprofit run entirely by UGA students, kind of like Athens PBJs, where we pack and distribute backpacks filled with supplies, give them out to those experiencing homelessness across Georgia. In addition to that, we'll do a lot of kind of encampment work here in Athens, working alongside John and Michael. And so naloxone and Narcan is something that we've kind of briefly explored in the past, but we work with an organization called the Pro Bono Partnership of Atlanta, who essentially provides pro bono lawyers. And so when we asked them, this was probably back in 2018, something like that, they were all kind of very adamant that, hey, this is something that you guys probably should not do. We're not 100% familiar with the law, but we don't want to have college students have any sort of liability. But I mean, kind of recently on a couple of different calls, it's been made pretty clear that like medical amnesty and Good Samaritan cover liabilities pretty strongly. And so we reached out again to our lawyers, and they said they kind of okayed our involvement in distributing Narcan. So I'm excited to be a part of this group and to work with that. And in addition to that, our former executive director currently has connections to the CEO of the company that produces Narcan. He said that he'll reach out to them next week. No promises on anything, on any big shipments or anything, but would be a cool lead to have potentially a large distribution scale.
I love it. And I just have to say this, I am raising 3 sons right now, Moses, Atticus, and Lazarus. And when they grow up, I hope they are very much like John and Harrison. I'm just saying. These guys like in their early 20s are just doing such lovely work. So I appreciate you guys. And I look up to you.
Thank you, Aaron. I appreciate that.
So guys, I think it is a tremendous news that we have already been able to get more naloxone in the next few weeks in the hands of folks who we are positive can administer it to people in need. We're not done. We're not even close to done. So I would like to talk a little bit more about what gaps there still may be, and to kind of introduce that part of the discussion before we start to wrap up in the next 15 minutes. We have a connection to the Student Government Association. He was not able to join us this morning, but plan to be meeting with him to have a discussion about how to increase availability across the University of Georgia campus, and have also connected with someone who has a lot of experience and passion for recovery within UGA Health Services. So we have built those connections and want to work with those stakeholders to see what would it look like to increase availability across UGA. That's one example. John, is there anything you'd like to add there before I move on?
I was just going to say that I have a close relationship with the student government president. He's one of my roommates. But I know that was one of the things that he kind of ran on his platform, and something that he's been working to address, unknowing that it was related to Envision Athens at all. So we're happy to have that discussion with him and know it's something that's been on his agenda for several months now.
Awesome. So John, yeah, let's, if we could maybe try to make those offline conversations happen between now and the next meeting, if possible, that would be fantastic. And then another key area is working with downtown businesses. We had a lead toward the end of last year that didn't really end up coming to fruition, unfortunately, but I have a couple of other connections that I'm going to lean in on. Do any of you have connections to downtown business owners that are strong enough that would mean you could talk to them about making naloxone available in their establishments and also getting their staff trained. Michael, I know you and I both have a strong connection to Jason. So if you have not yet, would you mind to follow up with him and start that conversation? And if you would like a tag team, I am happy to work with you to follow up with him and have a discussion about that.
I'd be happy to. Maybe we should meet again. You and I should speak before, because I know Jason's completely on board and trained, and to my knowledge, his staff is too. But his kind of connections and in his circle have kind of fizzled out this idea in terms of his partner, other businesses, neighbors, and so on. So I think we know a lot of the same people, but I'd be glad to talk to you about it offline.
Okay. And guys, what we found, again, for the sake of folks who are new, is trying to have this conversation at an institutional level is very challenging, meaning when we have tried to advocate for adoption of naloxone, being on site and training around it at the level of, a large employer, that is less effective due to, unfortunately, I think some of the stigma around this and folks just not wanting to take the risk or expose their employees to the responsibility that is implied by having naloxone, within their grasp. And so that's to be very candid with you. We can't resolve this and improve it if we can't acknowledge what is difficult about it. So far we've found that a more individual relationship-based approach has been more effective than trying to start at, someone who represents a conglomerate. That has not been as effective for the reasons I just mentioned. So I say all that to say it's going to take a little bit more time than the other approach would have. Do you guys have any thoughts about that? So to summarize, we have backpack project, PBJs. We have upcoming working with student government and UGA's health services. Michael and I will be following up to kind of restart the conversation related to downtown businesses. Based upon your anecdotal, but like really important experience regarding where overdoses have occurred in the last year to 2 years, are there some geographic placements of naloxone that we are missing that would have impact here? What are the gaps?
I don't know if this has already been addressed or not, but what about the extended stays? There seems to be, we have a lot of patients that stay in those organizations.
That's a good question. Does anyone have relationships with the extended stay hotel management?
One of our officers might. I can check with them.
Yeah. If you would, that would be really helpful. I do not have relationships there, but I'm glad you mentioned that, Shannon. That has been mentioned before. And I think because no one has a connection, that's kind of toward the bottom of the list, but I think that would, and if you all have specific places in mind, maybe send those to us in the chat box, or if you're comfortable saying them. I mean, this is a constructive space. So any specific locations in mind? Is Microtel one?
I don't know the name of the one that's right across the street from us, but I know that one of the Narcan kits that Riley used to reverse an overdose was over there. It's like right behind the Senior Soul and across from Alliance on Sycamore here. I'm not sure what it's called.
Okay. Yeah. Yeah. Brandy, I know that some of the anecdotal data about overdoses came from Sarah, the ARC. Anything you want to add in terms of suggested locations?
No, not so. Ours were that we were able to gather some of that data is from unsuccessful discharges from the program, and such. But equipping our alumni with the resources and the information of what that looks like, or people that are unsuccessfully discharged, we've started doing a warmer handoff and making sure they have resources and such, not necessarily putting Narcan in their hands. But when we did that work group right at the beginning of last year, I think there was a lot of really great information that came out from that. We did the listening session at Divas, and I think we could revisit that and look at if there is new creative ways to outreach in that area, in those areas, with the new platforms that we're using with the videos and such. But as far as any other areas, I know that even our Honeysuckle location, we've had somebody in less than a month ago, it's about 2 or 3 weeks ago, that was a former resident from years ago that came by with somebody in his vehicle that had overdosed, and we were able to help revive him and get him over to, and told him about the amnesty law, and was able to get him to the hospital. So even taking that as, former clients, and making sure that at our different locations that we have it readily available. We have it in every single one of our units and all of our offices. And if we could kind of replicate that in other businesses. But I was thinking about the different business owners that I know, and reaching out to them specifically. I think that I have a few people, but I'm not sure. I'm going to do some double checking. But I'm not sure where that list went from our listening session, but I do think that we could revisit that as well.
Sure. And I wasn't a part of that, but Ali and Brandy, if you wouldn't mind to do some digging, and I know we typically have Shonda with us this morning, if you guys wouldn't mind to follow up and retrieve that, I think that could kind of be our working list. My hope is that this group can kind of divide and conquer. In other words, at our next meeting, if we can start with a strong list and then each agree to follow up with specific folks, and then kind of have some nice friendly accountability in the group to keep that going, that would be helpful. And then Judge Auslander, will you share a little bit about the link that you just shared?
I just saw this in the paper a couple of days ago, and you asked that question, and
yeah,
it just seemed to help answer the question. I'm sure it was already targeted by the list they came up with.
Well, if not, I think it makes perfect sense, and definitely something that I'll add to our list just in case. That's great. Okay, any other thoughts about target locations or anything related to naloxone before we move on?
So yeah, I have a question. So in the event that we do have a list of people in between now and the next meeting that are engaged, how would you suggest that we go about setting up a training for their staff and getting some supply stock for them?
Mm-hmm. Well, yeah, let me check back in here with Ali. I know that last year, because of COVID, there was a point at which you had more than enough naloxone for a time. The supply actually exceeded the demand. What is the status on that now?
I still have plenty.
Okay. And
so most of it is the IM kits that you have to inject, which are still very easy to use. They just kind of intimidate a couple people. So I don't have a ton of the nasal kits, but the IMs are a fraction of the cost, and they're very easy. So with a little training, I mean, they work exactly the same, they're just as effective.
Mm-hmm.
But yeah, we have tons of those.
Yeah, what it's made difficult for us to be able to use a lot of those kits is as a needle, right, Allie? And so that we can't pass those out to our residents or those that are discharging from our care.
Right.
But the business owners and such and managers at different businesses, that's going to be a different story for them. But that's a little bit of a different story for Beverly and I, but not so much for the other folks that we're talking about.
Right. That makes sense.
I'm glad you mentioned that because that is intuitive. However, I didn't know that. I wasn't aware that that's an actual barrier. So we might need to collaborate to find some funding support for the nasal kits. As our list grows, if we have willingness, we certainly don't want to forego naloxone availability simply because we don't have the kits. And maybe Harrison's connections can help us out there. Not to put you on the spot, but I'm putting you on the spot.
We'll see.
Sorry,
No,
not-
no promises.
All right. So as we start to close out, Allie, is there anything that you wanted to share just in terms of upcoming outreach and thoughts on how to optimize that?
Yeah, I just wanted to make a really quick plea for everybody to please get your COVID vaccinations as soon as you're able to. I think that it's just not, I mean, we have all these grand ideas about where we can go out in the community and do training here and, you know, give out kits here. But I mean, the reality is it's just not entirely safe and we need to be vaccinated. So, I mean, I know we're all wearing masks and being really careful, but I just want to implore that everybody, you know, please sign up as soon as you can. A lot of us have already done it. It's painless. We've had no side effects. So I would love to see us be able to tackle more stuff on our to-do list. And I do think we can do that, you know, safely if we get vaccinated. So there's my spiel.
Thanks, Allie. Guys, as we prepare to close out, any other agency updates or thoughts that you all want to share?
I just wanted to mention about the Athens Recovery, Diversity, and Inclusion Initiative. We're in the process of launching a video series. We're trying to figure out if we're just going to do it on YouTube or do it on Zoom and YouTube. And what we are aiming to do is gather recovery stories of marginalized populations, as well as their families' experience. And so we have a list together. So if you have any alumni of your program that would be willing to speak to us, and it's going to be sort of like an interview style, but we'll do recovery messaging training in the beginning to kind of help with strength-based approach terms. I've been working with Tony Sanchez on that and a few other individuals. And so that's the next step for the inclusion initiative is just getting together some recovery stories and spreading awareness. That's a way to safely do it while the numbers continue to spike with COVID. And so again, I'll throw my email address in there if you have any recommendations of people that might be willing to be interviewed and share the recovery story and journey. It'll be some tough conversations, but what we found is there's a lot of people that are really willing to listen and really want to learn. And there's a lot of people that are willing also to share their recovery stories and their experience because they also want to see change in the community.
Great. All right. Thank you, Brandy. All right, everyone. Thank you so much. We have a lot to meet about. Our next meeting is February 10th. So Wednesday, February 10th at 10 a.m. We will regroup on establishing a Recovery 101, also establishing a recovery messaging training for any of us who want to join that. I will be one of the people who attend that. I'm welcoming Dr. Watley back to share a little bit more about her plans and vision and opportunities to partner. And then we will also make it a point to locate that list of hopeful naloxone sites and start to dig into outreach there. All right, it's 11:01. Thank you so much. Have a great day.
Thanks, Aaron. Bye, everybody.